Hello there, everyone. Welcome to the Empowered Woman Talk Show live broadcast. I am the host, Gladys Gadry. Today, we're privileged to have Dr. Erica Chowa, all the way from Atlanta, Georgia, join us. And before she comes on, let's watch a quick clip of her.
My name is Dr. Phindeli Erica Chowa, and I am a Harvard-trained, board-certified emergency medicine physician. I have over 10 years experience working in the emergency department. I started EM Care to You after working during COVID. Currently, our emergency departments are overcrowded. Urgent cares have long wait times and close after business hours. And primary care physician appointments are taking over 3 months to schedule. As a result, patients who have urgent complaints, such as the common cold, urinary tract infections, cuts, boils, post-operative visits, are finding it extremely difficult to access a provider in a timely fashion. I thought to myself, our patients deserve better. If we can't see them in our hospitals and clinics in a timely manner, we really need to meet them where they are. We need to go inside their homes and see them.
I was concerned about the healing of my wound and the symptoms that I was experiencing. As a working mother and a wife, it is hard to leave my house. I called my doctor and they couldn't secure an appointment with me for 2 weeks. I called Dr. Chowa and she came and saw me the very next day.
The best part of my job is being able to go inside my patient's home, being a part of their family, and seeing them improve, and just never having to leave their comfortable environment. I love that. We can draw blood work, we can start an IV and administer IV fluids. We can conduct nutrition consultations, work, employee physicals, sports physicals, and we even interface with local radiology departments and can order you an X-ray, CAT scan, and you never ever have to leave your home to go and get a prescription to get these images done. So there's really a benefit in calling us.
Seeing Dr. Chowa in the comfort of my home was the best for me as a mother and a wife. I felt no judgment. I was reassured. She was kind and very attentive. She truly listened to me, understood my concern, and told me what steps I needed to take for the next few days.
We don't judge here. We take care of anyone. You may not have insurance, you may be visiting or working from out of state, or you really may be finding it difficult to access the healthcare system. Don't you worry. We'll take care of you.
Ladies and gentlemen, please help me welcome to the Empowered Woman Talk Show live broadcast, Dr. Erica Chowa. Hello, Doc. Welcome.
Hello. Happy to be here.
Welcome to the Empowered Woman Talk Show, Doc. How
Yes.
are you?
I'm doing good. I'm doing great. Just blessed and highly favored. Happy to be here and just talk about women's health issues.
That's great. Welcome once again. And can you please elaborate on how all this came about? You know, how all this came into being about your practice and your focus on postpartum women.
Yeah, so I myself have a 6-year-old and went through a very difficult pregnancy. Prior to carrying my child, I suffered a miscarriage, and so entered pregnancy with just some anxiety, and then during the pregnancy, I had some bleeding, and my childbirth experience was pretty traumatic. My daughter had to spend some time in the ICU. My breast milk didn't come in, struggled with breastfeeding issues and postpartum depression. And so I carried that experience with me, and didn't really know how that experience would play into what I do now until I went through COVID, right? Went through COVID where I was working as a medical director in the emergency department, assistant medical director in the emergency department, and just saw the impact of COVID on our communities. And I thought to myself, I don't know longevity wise if I can stay doing this for a really long time. And so I sat down, sort of, prayed about it. I thought about, what else could I be doing with my life? Because I love medicine and I love taking care of patients. However, I'm deeply unsatisfied coming to work. I just don't feel like I'm giving the best care. So I just sort of, went through different scenarios. And then I had a mentor who was a concierge physician who would go into the homes of his clients. And I think I shadowed him a few times and went in to see some of these patients. And I thought, this is amazing, right? I would
Yes.
love to do something like this. I get to interact with the families, I get to build relationship, and the families, they listen a little bit better, right? They feel comfortable with you. You're able to make recommendations. They trust you. And so I literally told myself, this is what I'm going to do, right? So I did all the planning around it. And in 2023, July, I quit my job, went into doing this. Now, little did I know that when I would go into people's homes, that I would be seeing moms, postpartum moms, moms with young children. And I would go in for, routine complaint like, hey, can you check out my C-section wound? Or, I'm having symptoms of UTI. But it would become so much more than that, right? Moms would be crying. They're struggling with breastfeeding issues. They're clearly struggling with mental health issues. I'm picking up, elevated blood pressures. And so it then took me back to my own experience, right? Going through pregnancy and childbirth. And at that point, it was like an aha moment. Like, I went through all these experiences in my life, and now the patients that I'm taking care of are postpartum. And so I tied those together, and I really felt that that was my calling and what I was meant to do. And it just gelled so well. And I'm able to bring my own experiences. I'm able to motivate moms. And I'm able to build those relationships that allows them to open up and tell me symptoms that they may not otherwise call their doctor and talk about. And I'm able to do it within the comfort of their own home. So that's how EM Care to You came about.
Wow, what a story.
Mhm.
It's amazing. I'm glad. I think Doc, your volume was a little lower.
Oh, was it lower? You couldn't hear anything?
Yeah, I could hear you, but it was a little lower.
Oh, I'm so sorry.
Yeah, so if you can turn it up a bit.
Sure. Can you hear better now?
It's better than before.
Okay. Okay.
Yeah.
I'll try to speak in the mic. Maybe that's what it is.
Perfect, perfect. Yeah, but I'm glad you shared your story, of postpartum depression,
Mhm.
and your pregnancy, because I did a little research, and according to the research, it says that about 10 to 20% of people who give birth are affected by postpartum depression,
Mhm.
and Black mothers have a high prevalence of postpartum depression. However, postpartum depression rates have increased among all racial and ethnic groups since
Mhm.
2010.
Mm.
So this is alarming, as the research indicated that postpartum depression is a serious condition that requires treatment. So I'm glad we have doctors like you who have dedicated their practice to these matters. So
Mm.
then this leads me to my next question. It's like, what motivated you to adapt this personalized approach to care, and how has it impacted your patients' experiences?
Absolutely. I think about just my experience when I was postpartum, right?
Right.
I was having a lot of thoughts of, sadness and increasing crying. And, I was taking all the tests at the kids pediatrician office and my OBGYN's office. And I failed the test that was screening for depression. And what I was told was, okay, yes, you're scoring high. We definitely need to get the help. But there wasn't there wasn't really direction at where I was to get the help. I don't even think I got a list of therapists or psychiatrists. It was like, yes, we've addressed a problem, so now you need to go figure out how to get the help. Now you can imagine when you're postpartum, you're going through so many things. You barely are sleeping, you barely are taking care of yourself, and now somebody's telling you now you have to go and look for help, right?
Right.
I think the reason why personalized care works for postpartum women is because someone is looking at the person as an individual, right? And they have more time to spend with that individual. In a regular clinic office, maybe you're getting 10 minutes of listening time, 15 minutes, and a woman is really not disclosing everything, and in fact she may not even herself know that some of the things that she's struggling with are an issue. And so the personalized approach, I go and I sit next to the women, we talk about things, I ask them questions, I ask them about their mood, I ask them about, their breastfeeding, I ask them about physical ailments, I check their blood pressure, I check their vitals, and then I make a plan that makes sense to them, right? Because maybe one person needs to see a lactation consultant, someone else does not. One person may need a psychiatrist and may need to go on medications for postpartum depression. Someone else may need just more help in the house. They may need focus groups. They may need more help in the home, like cleaning and friends and family. And so everybody is different, and everybody follows a different approach. And so we can't treat every mom the same. And so that's why I think postpartum personalized care works for many of my patients. And it's really impacted a lot of my clients because, in a lot of cases, I have picked up on things that, may not have, they may not have told their doctor. And so there's just that open, environment where we can share, I can ask, and they just feel comfortable talking to me.
Yeah, that is so great because, I've had three children myself, and I'm sure at some point I experienced postpartum depression. We don't often admit to it, but most women go through these challenges and we don't communicate it. So having a personalized doctor, like the care you provide or the services, is very, very helpful. So you can tailor the care directly to the individual person. So this is where I believe the medicine, what's it called, the concierge medicine model comes in. So then how does the concierge medicine model help you address the unique health needs of postpartum women?
Yeah, I mean, I think it kind of goes back to what I said earlier. The concierge is different than regular medicine because it is tailored to that individual. The very root of concierge care is personalized care. And so it's really care that's directed to that individual person. Every concierge practice is different. If you think of what concierge means, it's really like you work for that individual. And so when patients come into an agreement with me, it's with me. I work for them, right? And so that is different from if I work for a hospital, right? And so then the patient comes to me and then they are literally coming to my clinic, but I'm not working for them. I work for the hospital, if that makes sense. So because I
Yes.
work for that person, I'm able to advocate better for that person. I'm able to recommend things for that person. I don't have people telling me how to practice and what to give my patient. And so everything is joint decision making, and it really is for the betterment of that patient. So I hope that makes sense.
Yes, it does. I love that. Yes, wow. So then understanding the risk that,
Mm-hmm.
so as February is significant for heart health,
Mm-hmm.
what cardiovascular risk do postpartum women commonly face, and why is this period critical for heart health?
Absolutely. As you know, cardiovascular causes of death are, in postpartum women are the leading causes, right? And so when we
Yeah.
talk about cardiovascular causes of death in postpartum women, we're talking about things like cardiomyopathy or heart failure. So a woman's heart is weakened as a result of going through pregnancy, childbirth, and so they get something called cardiomyopathy where their heart swells and it doesn't pump very well, and blood backs up into their lungs. They get swelling, shortness of breath. And so that's one thing. Another thing that most people know about is preeclampsia. The thing is, people think that preeclampsia only happens during pregnancy, but people can get postpartum preeclampsia. Now, the unfortunate thing is, if women did have preeclampsia during pregnancy, that can increase their risks of cardiovascular complications after they give birth. And so there's heart attacks, there's strokes, there's a lot of different things that women have to watch out for. But just to kind of keep it basic, I would say that women, number one, especially women who have risk factors for heart disease, such as diabetes, gestational diabetes, pre existing diabetes, high blood pressure, pre existing high blood pressure, preeclampsia. Those people are at risk of getting complications after they deliver in the postpartum period. So, heart attacks, strokes, heart failure, all of those things can definitely put them at risk for these conditions. And so, those are the conditions that I typically talk to my moms about. And a lot of what I do is screening for those conditions. So, the very first thing that I do with my moms is I check a blood pressure.
Yes.
Hands down, I check a blood pressure, I check some vitals, and I go through and I ask them questions if they're having difficulty breathing, chest pain, swelling in their legs, headaches. All of these things are very important in screening our moms.
Wow. Yeah. This is so great because I had gestational diabetes during my pregnancy. Actually, my first one.
Mm-hmm.
Yeah. So I was placed on a diet. So I lost 10 pounds before I delivered, but then after the delivery, it went away. The diabetes went away. So that was a
Mm-hmm.
lifesaver.
Yes.
Yes, because they said the pre gestational diabetes can later on develop into a diabetes if we don't watch
Absolutely.
our diet, exercise, our nutrition, and things like that. So it's good that you take the initiative in doing your assessment of your patient during this period postpartum so that they can avoid all these risks that will lead to high heart diseases. So I think you're on
Absolutely.
the right approach.
Absolutely. And even, for moms who have complications like a gestational diabetes or preeclampsia during pregnancy, I watch those moms more, right? And even we know that years down the line, people who've had preeclampsia can be at risk for heart disease. So my moms who get preeclampsia during pregnancy, I'm having them follow up with cardiology. They're being monitored because their preeclampsia can give rise to cardiovascular complications way down the line in the future. So these are little subtleties that are just really important for providers to understand. If a mom's gone through a complicated pregnancy, they need more attention. And so that's where I kind of bridge that gap for moms.
Yeah, that is great. So then signs and symptoms. So then what warning signs should
Mhm.
postpartum women be aware of that might indicate a cardiovascular issue?
Yeah, so shortness of breath is a big one, chest pains, increasing swelling in the legs. And so we know we swell when we give birth because of all the IV fluids and also just there's a big baby sitting on all your blood vessels in your belly. But significant swelling more than normal. And so if let's say your legs were not swollen and then a week down the line you having swollen legs, you're short of breath, those are red flags. For some women, they can feel lightheaded or dizzy. Some people can get palpitations because of the increased demand of the heart. For some people, there could be headaches, weakness. And so those are the ones I typically will tell people. And I have moms check their blood pressure. I encourage them to have a blood pressure cuff within the home. And if anybody's blood pressure is elevated, 140 over 90, that's a red flag. We want them to see their provider. And for lots of moms, they may not have any symptoms except for an elevated blood pressure. And so that always is of concern. When a woman's blood pressure is elevated, they don't have any, symptoms. I tell them, go see your OBGYN or talk to your OBGYN so that this can be closely monitored because um, it can become problematic.
Oh, yeah. So then, well, Doc, are there any silent risk or conditions often undetected in postpartum women?
Mm. Well, I would say, I mean, the blood pressure, that's the
Okay.
biggest thing because for a lot of women, they tell them when you leave in the hospital, if you have a headache, you have blurry vision, you have swelling, these are all signs that you may be having postpartum preeclampsia. But I've picked up at least two or three women who've had no symptoms and have had postpartum preeclampsia. And so that blood pressure is really a silent killer because many women may not know that it's elevated. And so that's just one thing that I tell women is that it is unfortunate that you may not know you have an issue until it's too late.
Wow.
Mhm.
Thank you for educating us on this.
Hmm.
So then, Doctor, preventative measures. So how can postpartum women prioritize their heart health? Are there specific lifestyle changes or medical interventions you recommend?
Well, I recommend starting even before you get pregnant, right? And so this is a big push. I think many women don't understand that pregnancy is a very stressful, medical condition, right? And I hate to say
Right.
condition, but if you look at it from a medical standpoint, your body's undergoing a lot of different changes. And so if you enter pregnancy with poor health, whether it's pre-existing medical conditions or just general, bad habits, maybe smoking, unhealthy dietary habits, not exercising, that does increase your risk going into pregnancy, going into childbirth, and then going into the postpartum period. Now, when you happen to get pregnant, you want to keep active during the pregnancy. You want to eat healthy. Don't eat for two like they tell you. You just need to eat nutritious meals. And you want to keep active. You want to continue to walk. Um, there are some women who have limitations during pregnancy, so they can't do all those things, but you can get creative. But you want to keep moving. You want to keep moving because also increasing weight gain can cause a lot of complications as well. Now, once you get to the postpartum period, I would say that women need to prioritize their sleep. A lot of women are up, right? I mean, I'm guilty. I never slept. I just pumped nonstop because I wanted to produce breast milk for my child. And so I did not sleep. I did not eat healthy. And so thank God I made it through that period with, no medical conditions. But I don't advise women to do that, right? Because the
Right.
lack of sleep affects your cardiovascular risks. The lack of sleep puts stress on your body. It leads to insulin resistance. It can cause problems in the long run. And so prioritize your sleep, prioritize a healthy diet, and move when you're approved to move, right?
Right.
Obviously, when you first give birth, you don't want to be up, doing too much, but you can take walks outside, with at sunset with your child. Doesn't have to be anything vigorous, but just get some sunlight, get that vitamin D. All of these things are important.
Right. And Doc, I smiled when you said that don't have the notion of eating for two. I was
Yes.
guilty of that.
We
During
all
my
are
first
guilty.
pregnancy, I was guilty of that. I had the notion that I was eating for two, so I just ate and ate, and I gained over 40 pounds,
Yes.
and that's where the what's it called, pre-diabetes came into play. And then I was, like I said earlier, I was placed on a diet, and I lost 10 pounds before
Wow.
I delivered. Even during delivery, I was at risk because of the
Mm-hmm.
pre-diabetes. Yeah, so I was at risk because the child was also at risk,
Mm-hmm.
for developing diabetes.
Mm-hmm.
So it's so necessary that we adhere to some of these advice that you're giving us, that, postpartum preparation start during pregnancy or even before
Absolutely.
pregnancy, you know.
Absolutely. Yeah, that's
Yes.
key. That's key for women to know is that preparation piece. I think we're all excited for the pregnancy and the baby's arrival, but we're not really preparing to enter pregnancy. We're also not preparing to enter postpartum. So generally, we go through pregnancy unprepared for the realities of after we give birth. And so preparation is absolutely key.
Yes, I agree. So then, Doc, how soon after delivery should women have their cardiovascular health checked, and
Mhm.
how often should they follow up?
Yeah, I mean, I think this really depends. As soon as you get home, right, I have women check their blood pressures. And so that's just the standard for everybody who gets home within those first 6 weeks. They should just check their blood pressure. Go get a cuff from the store. Just do it. Trust me on this one. And so for other women, however, who have had the preeclampsia, during pregnancy or have had some complications during pregnancy, we generally want them to be able to see cardiology early within that first year, especially if they're still on medications, they need their medications managed. And so, for most women in the postpartum period, they don't necessarily have to go see a cardiologist or have to get their heart specifically checked out with imaging or what we say EKGs. But those women who did have high risk pregnancies because of preeclampsia or gestational diabetes, we typically do want you to see a cardiologist within that first year after giving birth.
That's so great. So
Mhm.
then I think you've answered my question, because my next question was, what should a woman do after leaving the hospital to
Mhm.
minimize her risk of cardiovascular complications? So I
Yeah.
believe, like you said, the blood pressure,
Hmm.
yeah,
Blood
checking the
pressure
blood pressure.
stuff for sure, and sleeping and eating healthy and light exercise or walking.
Yes, thank you.
Mhm.
So then we're still on the preventative measures. So what role does mental health play in cardiovascular well-being postpartum, and how do you address this connection in your practice?
Yeah, I mean, mental health is huge when you talk about body stressors, right?
Yes.
We know that stress can lead to what we say damage to the small blood vessels, so endothelial damage. That damage is what can lead to cardiovascular complications like heart attacks, right? And
Right.
strokes. And so, although there's not a direct one-to-one cause that, okay, mental health leads to cardiovascular risk, mental health is a stressor, and that stressor can lead to insulin resistance. That stressor can lead to damage of the small blood vessels in your body, and that in turn can increase your cardiovascular risk. And so, if we can reduce the stress that moms face, by intervening if there's any mental health conditions, yes, you definitely are lowering the risk of developing cardiovascular disease, because having a mental health disorder such as postpartum depression is extremely stressful to the body, right? You're
Yes.
not
Yes.
sleeping, or you're sleeping too much. Your brain is just not functioning well, and that increases your stress for sure. And so, if we can address this, we're definitely making a dent in cardiovascular risk.
Good. Thank you.
Mhm.
So then, Doug, education and awareness. Are
Mhm.
women generally aware of the connection between pregnancy and heart health?
I don't know. I would say not so much, right? I think a lot of women are not going into pregnancy worrying about their heart, especially if they're generally healthy or young. I think, us older moms, we probably have more of awareness about this, or we're thinking about it because we're already, what they say, advanced maternal age. But I think younger moms may not necessarily be even thinking about this because they're thinking they're generally healthy going into pregnancy. So I would say no, the awareness there is probably not as high as we would like it to be.
Okay, good. So then, what can healthcare providers do to improve awareness?
Hmm. Well, number one, I think women just need to know overall before they get pregnant what that means, right? I always talk
Right.
about, yeah, I mean, I don't know if most women understand that how pregnancy will change their bodies, how it will change their pelvic floor, how it will change how things sit. And so most women are thinking, yeah, I'll go into pregnancy, I'll gain a little bit of weight, but I'm gonna have this happy child. No, you may have some pelvic floor issues for good part of your life. You may have some back pain. You may have some residual, damage from what the baby did. And I think we as providers need to be very open and have open conversations with our patients and say, this is what pregnancy can do, right? And so if you
Right.
go into pregnancy already overweight, already with poor habits, with pre-existing conditions, this is going to increase your risk of cardiovascular disease. You're going to increase your risk of complications. And so if you're thinking about getting pregnant, these are the things that can set you up for success. This is how you can keep yourself healthy to prevent long-term complications. Because a healthy person entering pregnancy can still develop complications after giving
True.
birth. And so they should just know the risks. And that way they can make an educated, decision to have children or not. I think women are owed that. Some people may say, you know what, this is not for me. I don't want to do this. But at least if people know, they can go into it prepared.
That's so true.
Mhm.
Yes. So then, Doug, what role can partners and families play in helping postpartum women maintain heart health?
Yeah, a huge role, right? And so, one of the big things that I preach is preparing everybody, not just yourself, preparing your circle, preparing your friends, preparing your family, right? And so everybody should know what role they're going to play in the postpartum period. So if you have friends who are kind of come and visit, they need to be able to help you out in the home, right?
Right.
Decreasing your stress levels. So they need to be able to help you. So when they come into the house, instead of grabbing the baby and saying, "Let me hold the cute baby," no, what can I do for you? Can I clean? Can I wash your clothes? Can I cook for you? That's number one, right? And then family too can also help do that. They can cook, they can clean, but also family can reduce the stress level. I think sometimes our families, we can be very hard on each other, right?
Yeah.
You know, I come from a African family, and so sometimes there's some things, unwarranted comments and stressors that, they may not need to. And right, and when everybody comes to the house in your postpartum, maybe you don't need to get up and cook for all these people. Maybe people need to shower you, with food. So there's just boundary setting, and but you
Yes.
have to be very clear with family before you give birth about what you want them to do. And then also they can, try to check in with you, make sure that you're feeling okay. If they are also educated about the warning signs, they could also be able to pick up on things. And so one thing that I talked about, because I'm, in the medical profession, is that when I was pregnant and going into the postpartum period, I made sure I told my husband that if I collapse, if I look dizzy, if I'm lightheaded, this is what you need to do. If I am looking swollen or if I'm incoherent. I mean, I went through a lot of different scenarios with him so that he was aware of what to look for. And so I think husbands, spouses should be in the room when the doctor is explaining these worrisome symptoms or what to look out for, because sometimes they're going to pick up on things before the woman. Even when it comes to mental health conditions, they can see when a woman is withdrawing or looking like something is of concern. And so family needs to be engaged in these conversations. They need to be actively involved in being around mom, helping decrease her load, but also being vigilant and looking for signs and symptoms that may say, hey, this needs somebody to take a look at this.
So true. And that I love the mentioning of coming from an African home.
Hmm.
I'm a
You know how we
Ghanaian.
are. You
I
know how
know.
we are.
It's like everybody that comes to the house, we gotta serve them. You gotta cook, you gotta do
Listen.
this. But
Hmm.
meanwhile, we need to be served, especially if you're pregnant. You need to be served.
Yes,
It doesn't matter who's coming to your home. They need to serve you. They need
absolutely.
to understand the condition you're in so they can serve
Hmm.
you and not necessarily you serving them because they come into your home. I know culturally
Absolutely.
that's what we're accustomed to, but in these
Hmm.
instances, we have to make an exception for our health sake and our baby's sake and our mental
Absolutely.
state.
Absolutely. 100%.
I love that. So then, Doug, can you tell us about Empower Mom and how it has helped spread awareness about cardiovascular heart health, and other pregnancy and postpartum related conditions?
Yes, so 3 times a year, I put on an event that's called Empower Mom. And, Empower Mom, we bring together birth workers in the city. And we bring together lactation consultants, pelvic floor therapists, mental health professionals, chiropractors, the people who I feel like really are play a core role in keeping mom healthy during pregnancy, during the childbirth period, as well as the postpartum period. So these birth workers, they come together, or including doulas, they come together and we basically host a shower for mothers. So
Oh,
it's not a
wow.
baby shower. Yeah, it's not a baby shower where moms are going to be gifted, baby bottles or diapers. We're not doing any of that, right? Because there's so many people in their circle, in their communities, in their churches, in their workplaces that are going to host baby showers for them. And so at the end of the day, they're going to have enough diapers. That baby's
Yes.
going to be taken care of, but who's going to take care of mom? And so the idea of mom shower is preparing mom for the postpartum period and making sure that one, she's built her village so that she's taken care of as much as she's taking care of her baby. And then two, it's really helping her understand the changes that her body is going through during pregnancy, understanding the symptoms that she's experiencing during pregnancy, and then also understanding that some things are not normal, right? I think a
Right.
lot of women, they're like, yeah, I've been sneezing and, I've been peeing on myself, for however long, but it's because I was pregnant, I had a baby. That's not normal, right? There's
Right.
no part of, peeing on yourself is normal. That is a pelvic floor issue. So educating moms on what is normal during pregnancy, childbirth, and the postpartum period, but also helping them understand that these people are necessary to improving their physical, mental recovery, right? And that
Right.
their insurance may even cover it. And so I bring these healthcare professionals and I bring the moms in the room, and we just basically we answer questions, we talk about how moms can prepare. It is really a great event that I wish we could replicate all across the country, because so many things that moms did not know. It is jaw dropping. And so I just think that we need to talk about it as women. We need to talk about all the things, so that women can go into pregnancy and the postpartum period prepared.
Yeah, I love that shower mom. Because during when I tell you, I've been through three pregnancies. I have three teenagers, and there was nothing like you talking about. I did not receive this one-on-one care
Mm-hmm.
at all. And looking back, my youngest is 14. Looking back
Mm-hmm.
14 years ago, had I received these cares, I would have been so much better then.
Yeah.
It's so necessary. So kudos to you and your team for doing this. It's so necessary. Like you said, if it could be replicated throughout the entire country, it would be so
Mm-hmm.
helpful to moms, because women go through so much,
Mm-hmm.
through the 9 months pregnancies. I think some is up to even 10, if I'm not
Mm-hmm.
mistaken. you know 10 months, and then postpartum, that's where you come in. So
Yeah.
it's so necessary. It's so necessary. So I pray that your business will blossom and cross, not just be relegated to Atlanta, but it will go across the 50 states and even across nations. We prophesy that into being right now in the
I
name of
receive it.
Jesus, because this is so necessary. It's so needed. Women suffer so much. They suffer in silence.
Mm-hmm.
As women, we don't voice out whatever we go through. We are taught to be strong. Especially if you're
Yes.
an African woman, you're taught to be strong. So you're not able to communicate your needs or
Mm-hmm.
fears, because if you communicate them, you're seen as weak, or not
Yeah.
strong. So it's so necessary of what you're doing. So kudos to you, Doc. It's
Thank you.
You're
Thank you. Thank
welcome.
you. And I think, even in these times we're living in, and it's just when you talk about maternal mortality and our moms just suffering and dying, I think it's important to prepare them and to talk about these issues. And so I pray that this can be replicated, because I just know what I went through as you share your story. I know how hard it was for me. And so I just don't want women to be able to suffer alone. It should not be the case.
So true. We should be able to enjoy the
Hmm.
child after going
Yes,
through all the stress of our bodies,
exactly.
you know. Yeah. So then, Doc, so what
Hmm.
steps can the broader medical community
Hmm.
take to improve cardiovascular outcomes for postpartum women?
Yeah, I think we need to, it's just not as much of an issue, right? I think when women have given birth, I think we need to take the time to question them and ask them about their birth experience and really provide a personalized approach to them. I think oftentimes once moms leave the care of their OB, they now go back to their doctor, their primary care doctor, but there's gaps there, right? And so the family doctor may be assuming that the OBGYN has done the whole, workup, has handled all their, postpartum complaints, but there's still things that are lingering there, and there's still questions that they may have, and there's still ways to optimize their health in the event that they want to have another child, or just to optimize their health if they had a difficult pregnancy. And so there definitely needs to be what I say, continuity of care. There needs to be a personalized approach. There's too many gaps in medicine. There's just too many handoffs, and things
Yes.
get disconnected. And so having someone who can bridge gaps is really important, so that that handoff can be seamless and smooth, and women may be taken care of after they give birth, because it's not a, I, 6 weeks, now I'm done. Like postpartum can be, it's a process. That
Yes.
healing of the body doesn't happen overnight. In
True.
many women, it can be up to 2 years, and some women still carry the badges of pregnancy and childbirth years down the line.
True. 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 Wow. So then, Doc, wrap up questions. So then, can you share a story where
Mm.
your personalized care approach led to early detection or management of a serious cardiovascular issue in a postpartum patient?
Yeah, so I would say my one of my early clients, and I always tell her story, but she called me because she was feeling, unwell, but she wasn't really able to articulate that well. She had gone to her doctor's office postpartum, and there she saw a clinician who told her that she was dehydrated and stressed, to drink more water, and her blood pressures were slightly elevated at the clinic. However, they basically dismissed her at that time, just saying, get some sleep, drink some water. And so she went home and she was feeling very uneasy about that. And so she texted a friend who referred her to me. And I got on the phone, video call, and I'm talking to her, and she was unable to really articulate what was going on. And at that moment, I knew it was just time for me to get in the car and drive to her and just assess her in person. And so when I arrived at the house, I sat and took a history. And when I checked her blood pressure was significantly elevated. And we
Wow.
checked it a few times. And eventually we had to call her doctor, or the on call line. And then we sat and we waited. And eventually she had to go into the hospital, where she ended up being diagnosed with postpartum preeclampsia.
Oh, wow.
Yeah, and that happened over the weekend. And so on the weekend, unfortunately, her blood pressures were still up. So we had to, titrate some medications. So it was a very long weekend for her of just close monitoring, because, many women just don't wake up. And so I am just glad that she was able to go into the hospital, get the
Yes.
medications, and we could have prevented something more serious. And if she also didn't persist and, get a second opinion, I think it could have been disastrous. But it didn't sit well with her, the clinic visit. And so she pushed further. And I think that saved her life too.
Oh, wow.
Hmm.
Yeah, because I know a few years ago I lost my friend's sister passed on
Hmm.
right after delivery, and it was
Hmm.
preeclampsia issues, postpartum
Wow.
preeclampsia issue. This was back in somewhere in Ghana, so
Wow.
but had it been caught earlier,
Hmm.
had her symptoms been monitored, continuously, perhaps her life would have been saved. But unfortunately,
Hmm.
she passed. So this tells us how important postpartum care is, and
Hmm.
what the services you offer, how important they are, because most people think that after delivery that's it. But I believe that after delivery, postpartum phase, that's when women need care the most.
Absolutely.
Yes.
Say that again.
I I said what I said.
Oh my gosh,
Yeah,
say that
I believe that.
again.
Yes, postpartum care can, if I may say, can supersede even the
Hmm.
pre-pregnancy phase,
Yeah.
because most often time women are left alone postpartum wise, and that's where
Yes.
most issues develop. And that, I'm sure you can elaborate on it a little bit. You know.
Absolutely. Yeah. I think when you think in pregnancy, moms are being seen, every 4 weeks, and then every 2 weeks, and then every week, and so they're being seen constantly. They're under a microscope, and then they're discharged and they're told to come back at 6 weeks.
That's right.
So for 6 weeks, you're at home suffering, thinking the things you're going through are normal. You are trying to survive. You're in survival mode. And
Yes.
then you don't see someone until 6 weeks. And then the 6 weeks, you're carrying a bag of complaints and things, but you have 15 minutes, and then you come, you may even forget about everything that's happened in those 6 weeks. But
True.
the most dangerous things are going to happen within those 7 to 10 days after giving birth. So if that's the case, why aren't we sending people to the home to see these moms? I mean,
True.
there's nurses, there's doulas who can check on moms. Like, this should be just a standard. There's in some
Yes.
countries in Europe, this just comes with, the healthcare. They just send nurses, midwives, they're sending pelvic floor therapists. But in America, we're sending no one. And in fact, after 6 weeks, it's time to go back to work. It's
Yes.
not okay. It's not okay.
Not at all. Thank you, Doc. So then, Doc, if there's one message you want postpartum women to take away about their heart health, what would it be?
Hmm. I would say you are your best advocate, right?
I love that. Yes.
You are your best advocate. You take it into your hands to learn about signs and symptoms, right? If you are not in the Atlanta, Georgia area and you can't come to one of our events, take it upon yourself to educate yourself. Listen to podcasts, watch videos, really try to educate yourself on the changes your body is going to go through and the signs and symptoms. Because it may not come from the medical community. We could be very busy. I'm gonna talk about my friends, my colleagues, right? And so
Right.
we do go over things, we put things in your discharge, but oftentimes it is really gonna be up to you to do a body scan and advocate for your health. And so take it upon your own hands to educate yourself on what you need to look out for. And there's podcasts, there's books, just continue to learn. That's really important.
So true.
Mhm.
Oh, wow. Doc, you've educated us so much. So then, Doc, how can listeners connect with your practice or learn more about the services you offer?
Absolutely. So you see my website here. So www.emcaretu.com. And then the phone number is right there. I also am on Instagram, very easy to find, at Dr. Chowa, Chowa. I'm on LinkedIn, I'm on Facebook, and I have a podcast called Fourth Trimester Voices, where you can basically turn it on and you could listen about conditions in the postpartum period. I have moms come and share their stories on there. I have birth workers. It just allows for people in that space to be able to have a voice and to share their stories. And in hopes that they're sharing their stories, that you also feel educated and feel that you can also conquer the fourth trimester. But those are all the ways you can contact me, or you can just send me an email at info@emcaretu.com.
Oh, that's so great. Thank you so much, Dr. Chowa, for educating us about postpartum and also cardiovascular health in this Heart Awareness Month, February. Thank you so much. I hope that people will solicit your business, because you've been so helpful, and I'm sure you'll be so helpful to them as well. So thank you
Thank
so much
you.
for coming on the show once again.
Thank you so much for having me. This is lovely. Thank you so much.
You're very welcome. Thank you so much. We look forward in bringing you on in a future show.
I receive it. I'll be here.
Amen then.
I will be here.
Amen then. So thank you all so much for tuning in. Until next time, this is Gladys Gadry, the host of the Empowered Women Talk Show live broadcast, signing off. See you all soon. Take care and God bless you. Bye for now.